Overwhelmed hospitals, delayed surgeries, burnt out medical staff, New Zealand is suffering a healthcare crisis. Well, the government doesn't like that word, preferring to label it a chronic staffing shortage. Whatever you call it, we're in trouble, made worse by a shortage of 4,000 nurses. A group claims they've got 700 nurses and healthcare workers ready to help. The catch? All those belonging to Nurses for Freedom New Zealand at some point have said no to the jab. But the Nurses Society say unvaccinated nurses are not wanted back.
Our position's pretty clear. They're a small minority, minuscule minority. They've displayed poor judgment. They've not met their professional obligations, and the health service doesn't want them back.
But during a crisis, sorry Minister Little, is it better to have an unvaccinated nurse rather than no nurse at all?
It's absolutely not good to have them back. They expose patients and their colleagues to risk, and they've displayed bad judgment. Nursing practice is to be based on evidence. They haven't followed evidence.
That's their position, but what do New Zealanders think? We commissioned survey company Yabble to poll Kiwis around the country asking, should unvaccinated nurses be allowed back to work? The no's were 43%, those who said yes, 57%. Joining us now, Nurses for Freedom representative Deborah Cunliffe. Deborah, what are you calling for here?
Nurses for Freedom said would like to see an end to the mandates and all healthcare practitioners return to work to support a healthcare system that's clearly in crisis.
We hired a polling company today, an impartial polling company. We asked, should unvaccinated nurses be allowed back to work? 57% of New Zealanders said yes and 43% said no. What do you make of those numbers?
Hi, Jessie. Kiwis are a really sensible bunch, so we're not surprised at all, and it backs up what we're hearing from the public. Mandated nurses have a lot of support behind them, and healthcare clearly matters to the people of New Zealand. Our nurses want to help.
If the nurses did go back, would you be happy for patients to choose to be treated by only vaccinated nurses if they so desired?
Hi, Jeremy. Absolutely. Personal choice is the key here, and it has been all along. What we would like to do is employ risk mitigation strategies such as rat testing or PPE so that we can assure the New Zealand public we're not going to pass on COVID any more than a vaccinated nurse.
Well, David Wills at the Nurses Society also says that number that you're using, 700 nurses, is an overestimation. What is that number really? How many registered nurses do you represent that could actually go back to work tomorrow?
Remember, this isn't just about nurses. It's about carers. It's about the 200 midwives that have been mandated. It's about the 500 allied health professionals and numerous doctors, dentists, consultants. In our case, we ran a snapshot poll of our nurses, and 75% of that 730 are registered nurses, and the majority of those are ready to go back to work.
And of course, Nurses for Freedom is part of Voices for Freedom. And that group, I mean, lots of Kiwis don't agree with that group, both your actions and beliefs. And we're not here to debate that. But why do you think Kiwis should trust this call you're making, or even trust your members as healthcare workers?
Actually, Voices for Freedom and Nurses for Freedom are two completely separate entities. They're not in any way connected. I am a Voices for Freedom coordinator, and I've made that very clear all along. But we are, and there's a connection between the two groups because, like NZVOS, Voices for Freedom clearly support our cause. But although the name sounds very similar, we are two separate entities. But our main objective is to get our nurses back to work to support a health system that's in crisis. And we want to be free to do that. And we want the mandates dropped.
Deborah Cunliffe, thanks for your time tonight.
Thank you. Thanks.
Well, welcome along to the project, everybody. Look, Mark Richardson is here tonight. If you're a regular project viewer, you will know that we're very pro-vaccination, pro-booster. And I think we were pretty surprised to see that result today. 57% of New Zealanders, according to this poll, keen for those unvaccinated nurses to come back.
We need the staff, but for one, I wouldn't want a family member being treated by an unvaccinated nurse.
I'm the same. I'm sorry. I just want to know that my healthcare workers are vaccinated and that they're all in the same camp.
Just for God's sake, get the jab, go back to work. Take one for the team. You know, every now and then we have to do something we don't want to do. But your country's calling. Get the jab, and go back. I don't care what your rationale is behind. Your country's saying we need you. So go and do something. It was like me fielding under the helmet. Close to the bat. I didn't want to do it, but I did it for the good of the country.
Right, thanks, Mark.
Did it work? Did you win?
Never caught one.